Well, good morning, everyone. I think we will get started here this morning. I can see people are still just filtering through the Zoom door, as it were. So we will just start attending to some of our housekeeping things before we get into what we are talking about here today. So welcome to today's webinar, Care Options Living at Home, here at Alzheimer's San Diego. We're happy to have all of you joining us today. Happy Wednesday. Here today with me for support and to lend his expertise is my colleague, Preston Stocking. He is an MSW and a clinical care coach. Hi, Preston. And I'm sure you want to say hi?
Hey, everyone.
I'm sure some of you folks have talked to Preston over time here, over the months and the years, and he and I, together with a group of other fantastic people, are members of the clinical services team. And so when you do call in or fill out one of our follow-up forms after a class or send an email to us, it's one of our team that would be responding to you. So glad to have Preston here with us today. He's got some good experience in some of the options we're talking about today, and we will be relying on some of his expertise. We've got lots to cover, and because of that, you know, everybody has lots of questions, and certainly we understand that. We're going to do our very best to answer questions for you here today throughout the webinar with, Preston's support, and we will stop a couple of times where Preston can provide to me a couple of live questions, which I'll answer. Having said that, everybody's got something that they want to learn more about or find out more about with regards to their specific situation. We do want you to ask those questions, but if your question is not answered here today, please either fill out one of our follow-up forms or call us or email us, because we absolutely do want to have that conversation with you and help you out with information and support however we can. And so as we go along, Preston will be sending out that link to that follow-up form throughout the webinar so that you can be filling those out, and those will come straight back to us at Clinical Services. So our agenda for today, we're going to cover a lot of information, and that includes starting with understanding long-term care, what that actually means, looking at options of in-home care, looking at adult day programs, also at some of the community-based services that are out there. Then, of course, we need to consider financial considerations. How are we going to pay for these things that we would like to utilize? And what are the resources and supports here in San Diego with regards to all of these different areas of care and support? So we'll start with understanding long-term care. And what we want to point out here is that we tend to use the term or the phrase long-term care a little bit loosely. And I think most of us tend to think of long-term care as a person being maybe in a nursing home. And really, long-term care is talking about the continuum of care that is available to us, whether we use it or not. It is available to us over the course of time. Pardon me. These are my allergies. They've been really bad lately. So with long-term care, really what we're referring to is what we call custodial or non-medical care over the course of time. So these are the different types of services and supports that provide that, again, very important, non-medical assistance with the basic activities of daily living. And that can be in a variety of different settings. You see through this blue bar, we've got some of these different settings displayed here. And so for today, as we're talking about non-medical care, we want you to be thinking about what we call the ADLs. And these are the activities of daily living. And what they are comprised of is what you see here. Our ability to eat independently, or do we need assistance? Bathing, are we able to shower on our own, or are we starting to need some help with that? Getting dressed, everything from getting the socks and underwear on to choosing, the appropriate type of clothing for the weather, for the environment. Transferring, meaning from chair to bed or back, or to the toilet seat and then back up again. And so just being able to make that movement of going from a seated position to a lying down position and to an upright position. That's what we call transferring. Toileting, being able to use the toilet and to be able to take care of our own personal hygiene after using the toilet. And then lastly, in the list of ADLs is walking or moving around, just being mobile, whether we need an assistance like a cane or maybe a walker or sometimes a wheelchair. And then further to that, if we're in a wheelchair, do we need someone to actually be pushing the wheelchair and helping us with that area of mobility? So these are the activities of daily living, and these are the things that different health providers, different care providers, that's what I should say, care providers, look at in terms of figuring out how much assistance does a person need at this point in time. So keep that in mind, and you've probably heard a few times that term thrown around just about, well, how are the person's ADLs? What are the ADLs like? So this is what they're referring to. So for long-term care, we are referring to a wide scope of services that includes both paid and professional services, as well as some of those unpaid and natural supports we have around us, which is, of course, family, sometimes friends and neighbors, and sometimes other community groups that we belong to, church groups, other organizations that may support us in different ways as our care needs are changing with age and with a potential diagnosis of dementia. It is very important. This is one of the most important slides in this whole presentation here today, folks, for everybody to understand that this spectrum of long-term care, the custodial or non-medical care, it is not covered by Medicare or other forms of traditional health insurance. Very, very important point. And it's one that is often misunderstood by people and can be a surprise to people that Medicare does not cover these types of costs for care in the home. And so we have to look at other ways to help access and utilize these types of resources. And when we get towards the end of today's webinar talking about the financial considerations, that's when we'll talk a little bit more about that. So for today's purposes, we are going to be focusing on these first two areas that you see on this continuum of long-term care, which is in-home care and adult day programs, and kind of the related ancillary services to those types of programs. So we do have a part two of care options that I think is actually going to be next week or the week after, and that will be focusing on these other two areas of residential care and skilled nursing care. But for today's purposes, we're just looking at these programs and services that are supporting people in the home. So here's another really important slide in this webinar. And there's no one right or wrong answer to this question. Is it time for more help? When is it time for more help? What we encourage you to do is to regularly sit down with yourself, get yourself a piece of paper, if you're a pen and paper person like I am, and think about these different areas and jot down some notes to yourself and try to be as objective as you can. Another good check on things is to sit down and ask these same questions while having a trusted family member or friend there with you to give you their objective opinion on how you are doing, how things are going in terms of the caregiving situation. Preston will chime in on this too, I know, but all of us in our clinical services team too often are talking to caregivers who have really kind of gone along with their caregiving and gotten heavily involved with it to the point that it's having some negative consequences. And we don't want that for you folks. We really don't. It's a stressful job, a stressful and emotional position to be in as a caregiver. And there are supports and resources. So we want you to access those. You see, Preston came on with us here right now. Thanks, Preston. What would you agree with me on that? I'm pretty sure you will.
Yeah, I mean, a constant for me, unfortunately, being here for around 3 years now, is the unfortunate story that I hear a lot, that care partners just call and they're putting themselves second so much, which is the natural way of a care partner. But unfortunately, they just wear down. And, at some point everyone's going to need that additional help, whether that's from a neighbor or a friend or that professional help. And most likely you're going to need some professional help at some point. And it's okay to admit that and to look into that and to get the help that you need.
Yeah, I totally agree. And, I mean, I'm just thinking even on Monday this week, I was on phones and I had a couple of different callers. They were calling just to say, I just am overwhelmed. I just don't know what to do anymore. And, we want you calling us before that happens so we can try and help you identify supports and resources to help prevent that from happening. So these are kind of some of the areas we want you to look at is, are you starting to have difficulty managing your roles and responsibilities? And by that, we mean, sometimes so much time and energy goes into being the care provider, the caregiver, the care partner, that things like attending to social connections with family and friends isn't happening. You're not seeing your own healthcare provider. The housework isn't getting done and the grocery shopping is getting hard to do. So some of those other roles and responsibilities that we all have are not being attended to. And for sure, and we see the negative effects on caregiver health. And, our research absolutely supports that there's the stress of being a care partner has consequences for people. So it's very important to try and put some supports in place so that you are able to appropriately take care of yourself. Now, Preston, what would you say about changing and challenging personality and behavior in the person living with dementia? And what is the impact of that on a care partner?
Well, at some point, there's going to be, I think one of the most common things is that when someone, especially a person living with dementia, gets used to a certain routine, it's going to be really hard. It can be really challenging to bring in that outside help and to change things up, whether that's with an in-home caregiver or using or going to an adult day healthcare center, which we'll talk about. So it's just trying to, um, we have other, I think a great class that I think we offer here is, managing resistance and communication skills. And those, have some of the tools that you can use to kind of address some of those things and try and make it more presentable to the person, because that's a big thing. It's just, you can recognize that you need the help. It's just then the other challenge is just trying to get that help into it and make it as cohesive as possible.
Yeah, I agree. For sure, an increase in personal care needs on the part of the person living with dementia means additional physical, mental, and emotional demands on care partners. Everything from, the physical aspects of, transferring people that you are, at danger of hurting your back, if you don't have good technique. It's just another added layer of responsibility when there starts to be incontinence and, a need for incontinence, use of incontinence supplies and regular cleaning of private areas because of the incontinence. And for some people, that's really taking a big step in the caregiving road. So, and these, everything, again, from a physical stress and strain to a mental and emotional stress and strain. So those are things to consider too, with regards to needing more help. I'm reminded of a son that I have been working with, and he's caring for his mom. He's doing a fantastic job. He's really good, very proactive. And what he has identified to me, stated to me, is that he knows that when his mom starts to become incontinent, that's when he needs to be bringing in care, because he says, as her son, I don't want to be providing that level of private and personal care to my mom, and that she, as his mother, wouldn't want that from him either. So, I think the point of this is just to say that we all have different levels of what we are capable of doing, just in the sense of physically able to do, kind of mentally and emotionally prepared to do. And we also have our limits, and it's good to identify those limits. Now, Preston, what would you say about safety risks and how that is impacting caregivers in terms of needing to think maybe a little bit more about bringing care in the home?
Well, I think, one of the most common questions I get asked is, well, I get a call from an adult child, and they say, well, mom is still, living on her own. I go over a couple times a week just to check in, bring her groceries. And at that point, which then they start saying, oh, but I'm starting to notice that she's becoming more forgetful. I notice that she's misplacing things, but then it's also, if you're starting to have that gut feeling of, okay, well, should I be going over more often, or that's basically your gut telling you that they probably need some more hands-on supervision, which is an unfortunate, but, common progression of dementia and Alzheimer's disease. So it's, and especially when it comes to wandering, a lot of times it's not a matter of if, sometimes it's usually a matter of when that might happen too. And so if you're starting to notice that that your person is becoming more and more active or is becoming more restless in their symptoms, that may be a precursor to them possibly looking to, try and find something they might wander in that way. So that's something that you might want to address as far as going through some of these options.
That's great. Thank you. I really appreciate that, Preston. And, I just think all of these things underscore the importance of, contacting us to do some talking and do some planning ahead. Again, before the, the event happens, the wandering happens, or, you're feeling overwhelmed and burnt out and stressed out, all of those things. We really want to work with all of you folks to be planning ahead so that, we can get some plans in place for you. So we're going to talk a little bit about in-home care now. So here we have, kind of a nice little chart here that shows us just some of the different types of in-home care we can be using. And so you'll see, let's just look on the far column here to start with. There's family, friends, and other unpaid natural supports. And hopefully we've all got a good amount of those in our lives. And if we don't, we need to grow that list, that's for sure. And then there are licensed home health care providers. Now, these are some important distinctions. Home health, so keep that phrase in your mind, licensed home health care providers. And then at the bottom, bottom of the list is licensed home care providers. So there's a difference between home health providers, home health care providers, and home care providers, but there's not a lot of difference in the language. So we have to pay attention to this. So what do our unpaid natural supports do, our family and friends? Well, if they're good family and friends, they may help with the housekeeping and the dishes and run the vacuum for us and clean the windows and that kind of thing. Unfortunately, my sister-in-law just broke her leg this past weekend. So her sons and her husband are the unpaid natural supports, and I'm going to get myself in there to help her out with some things as well too. So, and then of course we have the custodial care of things, which is, again, think back to that chart that listed all the ADLs. And so assistance with those non-medical tasks that we need to do of daily living, eating and bathing and dressing and brushing our teeth, all those things. Family and friends and natural supports can absolutely assist with that as well too. And medical service, which means taking our medications. Maybe if we're insulin dependent, that means taking an injection. For some people with catheters, that may mean, changing out the catheter regularly and irrigating it. And those are things that family members can do for people who are needing that type of care. And oftentimes for things like injections and catheter care, family members can be taught by health professionals how to do that and how to do that properly and appropriately. So, and then let's drop down to licensed home health care providers. And you'll see there's no checks for housekeeping. Nope. No checks for assisting with the tasks of daily living. Absolutely not. But there is a check for the medical services of medication administration, injections, and catheter care. So these licensed home health care providers are the people that you hire to come in and help with perhaps wound care, with, I'm thinking of a client I had that she had Alzheimer's disease. She was also undergoing some treatment for cancer. And because of the effects of the chemotherapy, she actually had a nutrition, a feeding tube. And so I couldn't assist her with that as a care manager. We had to have a nurse come in to be able to manage that aspect of her care. But these folks are licensed healthcare professionals. And, they cost a fair amount of money per hour. And, you wouldn't want to be paying $50 an hour. And I'm just throwing that number out there, folks. Don't take that to mean anything. But $50 an hour to a RN to vacuum your home. That just doesn't make any sense. So think about it in those terms. Home health, when we talk home health, we are talking medical services. So licensed home care providers, these are the people we can hire to come in the home that can do some light housekeeping. Notice we say it's limited, and that is limited to a certain amount of their time. And usually it's just defined as light housekeeping. So a quick vacuum, throw a load of towels in the wash, make lunch and tidy up the kitchen, just tidy up the bathroom. Those things are okay, but not like deep cleaning. Yes, home care providers can help with those ADLs, the activities of daily living. And this is where they can be a great support to people because they can come in and assist with the showering. Bathing and showering, Preston, I know you'll agree, we hear about that a lot from our families, that often it becomes just this kind of big thing, and it can be a bit of a battle sometimes. And, for many families, bringing in that home care provider to manage and assist with the bathing and the showering can make a difference. So that's the kind of thing they can do. They can also assist with incontinence care, in addition to all of those other things of grooming and eating and so forth. What they cannot do is administer medications or do any of those more medical things like insulin injections and so forth. But even with medications, folks, you can't have a home care provider take this pill box like I have and put a pill in their hand and then give it to a person. So there's some other ways of getting around that, but these folks cannot do medical services. So I hope that clarifies some things for people. Preston, anything you would add here?
I would say it's when you're going through trying to find the right support for yourself, it's always, and if you're in doubt as far as what each person provides, I would just say, or what each agency will provide, just go ahead and ask those questions. There's a lot of times where I think we get stressed and we're just trying to get as much support as we can sometimes, and sometimes we overlook things, and that's natural, right? We have a lot of things on our plate, right? The natural daily stressors of just life in general don't stop when we're caring for someone with dementia. So sometimes we overlook things, and if there's a lot of questions that we get at Alzheimer San Diego, and of course we're happy to answer them as far as what the norms are, as far as what this different agency is supposed to do or what they're not supposed to do. But it's also asking, they are a business and you are a client to them, so they should be accountable to you, and you can ask those questions as well. So if you're paying for a service, don't be afraid to ask those specific questions to them, and make sure that you have a clear understanding of what they can do.
Yeah, I absolutely agree with that. Thank you. All right, well, I'm going to let Preston off the hook here for just a few minutes here so he can see what's cooking over there in Q&A for when we do take a break. Preston, I'm going to ask you to come back in when we do start talking about adult day programs, though, okay? Thank you. So just as Preston said, with regards to, bringing in an in-home care provider, there are, and bringing in unpaid providers, whichever providers you choose, there are considerations for you. And, most of us, we don't kind of live in a bubble, although maybe we would argue about that over this past year. We kind of have been living in bubbles, but it's not just about caring for a person. And I'm thinking right now of a couple that I have been working with, an elderly couple in their late 80s. He has some health issues going on. She has Alzheimer's disease. And he has just recently had his driver's license suspended. So they've been managing pretty good at home all this time, he as her primary care partner. But now with the transportation change, their situation has changed some. So it's needing to look at kind of the bigger picture. And so, of course, transportation resources are a part of that. But there's more to it. It's like, well, then how are they going to get their groceries and, get to the bank and go get their hair cut and that kind of thing? And, what other things need to be done? I mean, if his license has been suspended now, which it has, does that mean then that there are changes in him physically, which there are, that he's maybe no longer able to do things like household maintenance because of just changes in the aging body and changes in vision? And so there's other considerations for their home environment, their care setting, in terms of what they might need for supports. And then, of course, if you have pets, as many of us do, I have 2 dogs. If I, am needing some personal assistance as I'm recovering from something and I have pets, well, who's going to manage my pets? Who's going to take my dogs for a walk and get them to the vet for their checkups and such? So there's that to think about as well, too. And then in all of this, you'll see I'm kind of skipping around here, but personal emergency response systems, I'm going to go back to the couple I had just mentioned, is it probably wouldn't be a bad idea for them to have some kind of personal emergency response system because they are getting older and their health status is changing in addition to the dementia. And so to have some kind of system in place, they want to stay in their home and, the family and so forth want to support that. So let's get some checks in place to be able to help them achieve that. I think often of a really good webinar I have seen several times actually, where the lady speaking says, saying that we want to stay in our own homes for as long as possible and or preferably die at home. She says that isn't a plan. It's a wish, but it's not a plan. So we need to think about those things. Okay, so back to what Preston was saying. When we're hiring non-medical in-home care, we do want to ask some questions. Now, the good thing here is that the Home Care Services Consumer Protection Act came into place in 2016. Prior to that, the whole area of in-home care was kind of wide open. Anybody could put up the sign and say, we are an in-home care provider, and bring in employees and then hire those folks out to homes. It wasn't regulated in any way, shape, or form. And now it is, thank goodness. And this particular act is obviously intended to promote consumer protection, and particularly of vulnerable populations like the elderly and people living with dementia. It does require any of these home care organizations, businesses, to be licensed. And it has also created a public online registry. And so this is for folks who don't work for a home care agency, who are independent, but they come onto this registry, and these folks have all been background checked. So, and what that background check involves is a criminal history. So whether you're using a home care organization, a business, or hiring a person from this public online registry, you are getting people who have been background checked, and with the home care organization, you know that they are licensed through this particular Protection Act. Having said all that, hiring in home care is expensive. $29 an hour is the average, and that's a 2020 figure from Genworth. So, I mean, we can all do the math. $29 an hour. Doesn't take long to add up, does it? So, having said that, though, you know, to have somebody come in maybe from an agency 1 or 2 times a week for maybe 3 or 4 hours to assist with bathing, that can make a big difference in terms of quality of life, both for the person living with dementia and for the care partner. So, but you do want to ask those questions that Preston talked about. So, what kind of questions? Well, find out what their hiring and screening procedures are for their employees. And additionally to that, what are their training protocols for, especially for the in-home care workers that provide dementia care? What is the level of their dementia training for their employees? You also want to talk about finding the right match for your person living with dementia. And this is really important, and probably I would suggest we maybe don't emphasize it as much as we should, because what is it's not uncommon, folks, for families to maybe have to try 1 or 2 caregivers before finding the right one. So you want to be thinking about personality-wise, what is the right match for your person living with dementia? Because you know your people. And so does, you know, your mom like somebody who's bubbly and funny and likes to kind of be silly and have fun? Or does your mom prefer somebody who's quieter? Will mom respond to somebody who's firmly directive, who kind of just comes in and is firmly directive and managing things? Or would she respond better to somebody who says, as a caregiver, says to mom, you know, I need your help with this. Will you come on over and help me with folding these towels or help me with making lunch? So think about what kind of personality matches, what kind of energy levels and demeanors are going to be the best match for your person with dementia, and make sure to communicate those. What services are and aren't provided? This is precisely what Preston was referring to. So, and ask them to be very specific. The other thing I would say with regards to that is be clear about what your expectations are. If you want somebody who is going to be socially engaged with your person living with dementia, so in other words, talking to them, playing games with them, taking them for walks, that kind of thing, be clear about that. You need to make sure you are stating your expectations as well too. You do want to be asking about costs, because sometimes if there is some kind of last minute thing going on, additional costs may be incurred. Let's say, for example, if some kind of family situation arose where you called the agency and said, we need the caregiver to stay for another 8 hours because such and such happened. Well, obviously you'll pay for that, but you might be paying extra because it's unscheduled. So, and with regards to that, scheduling policies, you want to find out how that is all working. And also what their after hours and emergency procedures are. So if a caregiver, a paid caregiver didn't show up at you know, your house at the designated time, what is the procedure? Do you call them? How, you know, how do you find out what's going on? And do they send a different care provider out? So find out what those protocols are. And of course, we want you to still be thinking about these COVID-19 questions to ask because, we're still dealing clearly with the, well, I'm not sure if we would even say residual effects. There's still impact from COVID. So what are the protocols that the agency has in place that is protecting both clients and employees? Do they use personal protective equipment with regards to masks, gloves, that kind of thing? And what kind of training have they provided their employees on COVID-19 and other safety issues as well, too? Do they have paid sick time for their employees? And hopefully the answer is yes, because of course we don't want any of our in-home care providers coming to a home for a scheduled shift when they are sick. And so a good agency will be offering paid sick time for employees. And limiting the number of staff placed in a household. You don't want a revolving door of hired caregivers coming in. So trying to keep it to, some consistency and regularity in terms of who's coming in. You also want to find out about their policies regarding outside employment. So, for example, here, if you find a caregiver that you really, really, really like as a family, and you all would like to actually offer that caregiver a job working strictly for your family, there's sometimes some fairly strict policies about that agencies have, because they want to protect their investment in the employee as well, too. And lastly, what I'll say here with regards to COVID is the in-home care agencies are not legally required to have their in-home care workers vaccinated. So you want to be asking those specific questions. Is the person that they are recommending come into your home to provide care, is that person vaccinated? And you have the right to say, no, you'd rather not have them if they have not been vaccinated. But again, the agency cannot require it of employees. So these are some really good websites to go to for more information on in-home care. And the top one is through the California Department of Social Services. And you'll get lots of good information and tips there. You can also contact us. We do maintain a list of local non-medical in-home care providers that do have dementia specific training, so that you don't have to go out and do all that back work yourself. So we've got that list. All you need to do is give us a shout and we'll get that out to you. So we're going to pause for a couple of minutes here, and I'll ask Preston to come in, and we'll take just a couple of questions and then we'll move along.
Yeah, there was a couple questions, and I know this was a couple questions about the public online registry to check caregivers. Is that information provided in the slides as well that we'll be sending out, or can I send out a link to that?
It is provided, but you can also send out the link in chat if you've got that handy, Preston.
Okay.
Yeah. And for sure, I mean, this is a good place to go to, this website here, the Department of Social Services.
Okay, yeah, there were some questions about where that link was, so I'll make sure you'll be getting all that information and when we send that out to you guys.
Absolutely.
So a couple questions that I think this is kind of just a good general one, and we kind of touched on this at the beginning, but one question was, my husband is refusing to accept that I need help. We have conversations about it and he will kind of say, okay, but then he forgets completely that I got him to that point and we have to start all over again with it. Are there any tips to address this?
Sure, and that's a good question. And it's actually a very frequent one. And Preston, you feel free to chime in as well too. Oftentimes, the way we, as the care partners, kind of introduce and present this idea of having a caregiver come in the home. If we change how we do that, that can make the transition and the introduction a little easier. So maybe you don't say this is a care provider, or maybe this is going to be the new assistant, and your own as a care partner. I've hired this young lady as my assistant because I just have so many things on the go that I need to have a little bit of help. No, she's not here to care for you. So don't worry about that. She's here to help support me, and a little bit for you too if you need help. So not saying, oh yes, you need a caregiver. Like, just let that language go, and introduce the person as somebody you've hired to help. The other thing is, sometimes if you put it in terms of, and I know this has worked for some families, is where they've said, well, look, this lady, she's a single mom and she's got 3 kids and she's been struggling, with the job market through this COVID thing. So I thought we would just hire her for a little brief period of time just to help her and her family out. So making it like you folks as the family are doing this really incredibly generous gesture to bring in this person that you don't really need, and just kind of doing the soft introduction that way as well too. And I think generally speaking, I would say that, it's not unusual for people to be resistant to having people care come in the home, and that people, they get used to it. So there might be some rough days at the start, but they get used to it. So
Yeah.
anything else you would add, Preston?
I would just, I think you brought up a lot of great points. I think both with in-home care, and we'll also be talking about adult day programs. The first couple days, it's, they're getting used to a new routine. So there's going to be some bumps in the road.
Yeah.
But, one thing I would say is, I think we are trying to, honor and give dignity to the person and make sure that they still feel involved in their care, and that's great. But sometimes, once you could get the approval of someone that's living with dementia in one moment, and then the next moment, 5 minutes later, because of the nature of the disease, they may not remember it, or they possibly change their mind, or they're more confused. So if you're waiting for their approval to get some of these services, you may not get that approval. And if you need the help, you need the help. So it's just trying to, like Jean said, trying to phrase it in a way that is somewhat presentable. But if you're, I would say don't wait for their approval to get the help that you need, because you might not get it and you just may continue to sink. So.
Yep, absolutely. Thank you. Well, I think we're going to move along here, Preston, just in view of time. So we're going to talk about adult day programs. Why don't you just stay on camera with me, because we'll do some back and forth. And just for everyone's knowledge, Preston has worked in adult day programs. So he's got some great knowledge and experience that we want to tap into. So adult daycare. These programs are also referred to as community-based adult services. That is sometimes referred to as CBAS. This industry Preston and I are in has all sorts of odd acronyms, and it's good if you get kind of familiar with them, because you do just hear them thrown around. So I do encourage you to kind of pay attention to that. So an adult day program might be referred to as a CBAS or vice versa. These are centers that provide a fairly broad range of services, both recreational and therapeutic, and very importantly, in a very safe and supportive environment. They are usually during normal business hours, a Monday to Friday type of thing. And, but I will say the business hours can vary. So when you see a listing for an adult day program that says a full day costs X amount of dollars. Make sure you ask what a full day is, because they might define a full day as 9 to 3 or 10 to 4 or 8 to 6. So the types of programs that are provided for adult daycare are varied as well too. So there are social day programs, which again can just be called adult daycare. And these are strictly social programs. They don't provide, any kind of level of hands-on care. If people need assistance with bathroom, with toileting, they don't do that. So it's social in nature, and is a really good fit for people with dementia, by and large, social day programs. The adult day health centers, the ADHCs, these ones have a social component, but they also can provide some assistance with those ADLs, like helping people out with toileting. And then there are the non-licensed older adult programs, and of which we have one here in the county. It's not fully opened yet here with COVID, and it is through Jewish Family Services. It's the Balboa Older Adult Program. But stay tuned on that one for when it will open. So I'm going to let you talk about the benefits of these programs, Preston, because you saw it up close and personal. And I have too. I worked in day programs too. So you've got two professionals here in front of you, folks who are going to be really cheering on and espousing the benefits of adult daycare. So Preston.
Yeah, I would say, the first two bullet points here, social engagement and cognitive stimulation, are the biggest pros to adult daycare and adult day health care that there is. I mean, there's a lot of, when I hear people struggling, trying to say, well, I'm trying to socially engage my person. They used to be so social, but they're not anymore. Going to an adult daycare or adult day healthcare can really provide that a structured setting where they can get that social engagement with with people in their peer group, and also with the friendly staff that's there. There's usually physical activity there. There's usually, the whole day is planned out. When you go there on a tour, you will get an activities calendar that plans out the whole month. So usually every day has some sort of exercise activity, followed by some sort of cognitive stimulating activity, followed by a lunch, and then more social engagement in the afternoon that can include, sing-alongs with music, things of that nature. Like I said, you are going to be provided a lunch. Some even provide, a breakfast if you get there early enough in the morning, or like a breakfast snack type of deal. Medication and healthcare monitoring. If you go to an adult day healthcare center, are usually, at least depending on how many people are attending, there's usually at least one nurse on staff, and as well as a few CNAs on staff as well, to help with, if your person needs assistance in the bathroom or transferring in and out of chairs, they can have that. And they can also dispense medication. A lot of people where I used to work were diabetic as well, and they would be handling that throughout the day and monitoring their blood sugar levels, things of that nature. Another big thing is safety and supervision as well. It's a place where, where you can send your person and know that there's going to be someone watching them, providing them with the great social engagement, but also making sure that they're safe throughout the day. Behavioral, there's a lot of great behavioral benefits. We talked about, once that person gets used to going to an adult daycare center, we hear a lot of times that the agitation can decrease over time, and their sleep schedule gets a lot better because they're going someplace for a full day and they become more tired, right? It's a pretty simple connection, but I hear that a lot. And we see that a lot once that person gets used to the transition. And it's also a great respite, and it's an underutilized source of respite for caregivers. A lot of times people will look for in-home care, and then if in-home care doesn't work out anymore, then they'll consider placing their person in a care facility. Now maybe that does work for individuals, and maybe an adult daycare center doesn't work, but at least trying to consider these as an option, as a go-between, is something that I think more caregivers need to do, because not only is it a great source of respite, it's a great place for a person that's living with dementia to go to. And it's also, from a cost perspective, it's a little more cost efficient compared to some of these other services as well.
Absolutely. And so I just saw a question come up in chat about, can you provide a list of adult day programs? And we sure can. So well, I'll have, when we're through this section, I'll have Preston send out that follow-up form again so that you can just request that be sent to you. And, what we will say is that the programs are in the process of beginning to open up. I think there's just, I want to say 1, 2, 3 of them maybe open at this current time. And the others have applied for, community care licensing is having them, provide some information and go through a little bit of extra hoops prior to opening because of the pandemic. So not all of them are open at this time, but they are moving towards that. And what do we have any idea of some of the target dates as yet for some of them, Preston, or not?
I don't know. It depends on each one. I know that a few of them are still open. They are open right now, and they are accepting new clients at this time. I think some of it just depends on each individual program.
Yeah.
But they're slowly opening back up. I know Poway Adult Day Healthcare Centers opened. I know the Glenner Care Center, which is a big name in San Diego, is open. So they're slowly opening up, and each one is going to look different as far as kind of their COVID-19 protocols, but they're slowly accepting new clients.
Yeah, good. And, the questions to ask are for sure the activities and the services that are provided. Do ask them about their dementia training. Some places have more and others have less, and it's good for you to know what, exactly where they're at in terms of that training. With regards to cost, oftentimes people are paying out of their own pocket for day programs. However, there can be some coverage provided if a person has Medi-Cal, has qualified for Medi-Cal, and or has benefits through the VA. And so you want to ask about those things. And I always also say, some of these adult day programs have scholarship programs through some of their donors. Some of them also have sliding scales for people that are on more limited income. So it's always good to ask about those things. With regards to transportation, some of them do provide transportation to and from the program within a geographic area. So ask about that. And you can work with the staff to have a visit, a trial day. And again, you can put this in terms where I think about the one family I worked with. They told their father, who was a kind of a social butterfly, and he'd been a very active volunteer throughout his life. And so they presented the adult day program as a place that had asked him if he would like to come and volunteer on a daily basis to help with the older folks. And he was happy as could be to do that. The average cost, again, this is a 2020 figure, average cost in California for an adult day program, about $80 a day. So still not insignificant in terms of money, but more affordable than the in-home care too. So
definitely.
Thanks, Preston. So we're going to go on and talk. I'm going to go through community-based services, and I'm going to go through them fairly quickly, just in the interests of time. And also because, again, I have several websites for these community-based services, and they are in the slides, folks. So you will get these sent out to you. So we refer to the community-based services as the bridge that helps keep people at home and with some external supports. And so there's senior centers, public libraries. We have programs that are called Program of All-Inclusive Care for the Elderly, PACE, and case management services. So I'm just going to go back for a brief moment here. The senior centers and the public libraries, these are in all of our communities. And of course, they were closed during pandemic, and now they are opening as well too. And, you know, you can find some good supports there with different programs that they offer, particularly through the senior centers. And I would encourage you to reach out to get connected with your senior centers and find out more about what they do have to offer. The PACE programs, the Program of All-Inclusive Care for the Elderly. This was a program that started up, I think, in the 1980s in the Bay Area in California. And it is a program that is a joint Medicare and Medicaid program that helps people who have healthcare needs, and it helps support them and helps keep them in the community and in their home instead of going to a nursing home or another care facility. It does cover all the Medicare and Medicaid healthcare needs and services that are needed, you know, for people to improve or at least maintain their health. And there are eligibility requirements for this particular type of program. People need to be 55 years or older and live in the area of a PACE organization. They need to have a nursing home level of care, which is a fairly significant level of care, and then be able to live safely in the community as long as they do get that help from the PACE program. And so we're lucky here in San Diego. We've got several PACE programs throughout the county. I think by my count, 6 of them, and all over the county. San Ysidro, Chula Vista, Bankers Hill, El Cajon, San Marcos, and a new one in Encinitas as well too. But there are, you know, these programs are across the nation. And apparently there are as many as 137 of them operating independently throughout the nation at this time. And I just have to say, I'm a big proponent of the PACE programs for those who qualify. Really fantastic supports for people. But again, you need to qualify for Medi-Cal and then have these other areas of eligibility with regards to healthcare needs and supports in order to maintain living in the home. So here's where all these different websites come about: case management and other local community-based supports. There's Elder Help of San Diego, great organization, all sorts of good things that they do for folks in our community. The FACT website, the Facilitating Access to Coordinated Transportation. So this is a database of all the different transportation options that are available here in San Diego. Everything from the MTS types of transportation to volunteer-based programs, to programs like Rides and Smiles or Go-Go Grandparents through Jewish Family Services. So it's all in there. You just need to type in your zip code to find out what is available to you, and then to go through the list to see which programs are appropriate for you. We have Glenner Care and Glenner Organization. Has a long history of working with folks with dementia here in San Diego. Health Insurance Counseling and Advocacy Program, HICAP, really fantastic organization. And these are the folks to go to when you have any questions about Medicare, and particularly when we are in open enrollment for Medicare. These folks know their stuff, so make sure you get in touch with them with Medicare questions. Jewish Family Services of San Diego, I've mentioned them already, and another really fantastic organization here locally. You don't need to be Jewish to access their services, and many of their services are at no cost. Some are at partial or share of cost, and some have, are paid out of pocket. All sorts of different options for families. San Diego County Aging and Independence Services. And so a variety of different programs available to folks through that entity here in San Diego. And then there's the Southern Caregiver Resource Center. And their focus is on caregivers. And they've got some great supports for all of you who wear that particular hat on a regular basis as a caregiver. Aging life care professionals, you maybe have heard of them or maybe not. There is an Aging Life Care Association. These folks used to be called professional geriatric care managers. I was one of them for a few years. These are people who are assisting families. This is a fee for service. They are assisting families and adults that are facing health conditions and disabilities of different types and sorts, and assisting in navigating their health care and their long-term care and in accessing those supports and systems. These folks are professionals with advanced education and really can provide a real level of expertise to families facing, challenging situations and uncertain as to what to do. And you can hire them just to come in briefly to do an assessment, a consultation to provide some objective viewpoints and recommendations, through all the way to hiring them long-term to be regularly involved in and supporting and advocating on behalf of you or your family member. So a great profession, and you can access, we'll have their website listed a little bit later here as well too, in terms of how to identify those folks. And we have professional fiduciaries, which I don't know if you've heard about these folks before. These are people who are able to manage financial, housing, healthcare, and other matters for folks. They are licensed by California's Department of Consumer Affairs. They are often in positions where they're bill paying and managing money, assets, and taking care of finances, but they are also able to become trustees and conservators and power of attorney for health to become the healthcare decision makers. So this is a great resource for people who may not have those family members or friends to step in to take on those kind of roles, and or if there's other reasons why family wishes not to step into those roles. Hospice care, this is a very specific type of care, and it is a concept of care. And hospice can be delivered to the person regardless of where they live. So if they live at home, if they live in a skilled nursing facility, or if they live in memory care, wherever that person resides, hospice will bring their services to that person. And it is providing comfort and support to the patients and their families when they have been determined by a doctor to have a life-limiting illness and have been, certified by the doctor to be appropriate for hospice care in their end of life time. And I have to, I'm as I'm saying it, I'm thinking I shouldn't maybe say it like that. I don't want any of you folks to think that hospice is only for like those last 2 weeks of your life, because in fact, a doctor will certify a person appropriate for hospice when the doctor can say that it is their professional belief, their professional interpretation of the person's medical status, that they are likely to die within the next 6 months. So a person can be on hospice for the 6 months. And then if they get recertified, they can be on it for another 6 months. So hospice is not limited to those last few days of life, folks. So, and it's a benefit everybody has through Medicare. And there are aspects of comfort care, personal attention, reducing hospitalizations. There is spiritual care, social work support, all sorts of different supports for families with hospice. So here's all those websites again that we've just kind of talked about here. And we can give you referral to some of these professions. And by that, I mean, we have resource lists of some of these local providers of these services. So you can contact us for those as well too. So I think we're going to go, just in the interests of time, right into financial considerations. And so this is a big one. And Preston, I'm just going to have you stay here with us because we're in the home stretch here, and we will have another brief Q&A session. So how do we pay for all of this stuff? Good question, big question. And I want you to be very intent on looking at what you see in the red print here on the slide. And that is, again, that Medicare and other forms of traditional health insurance do not cover the costs of long-term care. We said it at the beginning, and now we're saying it again. So how do you pay for it? We often have to dip into our own personal savings and assets. For many of us here in California and in other places as well too, some of our biggest assets that we will be using to pay for our costs of care as we are growing older is our homes, the equity in our homes. And so for many, many people, probably a majority, we are having to look at whatever it is that we have managed to plan and prepare for with regards to savings and assets. Some folks that were very smart in forward thinking purchased long-term care insurance policies. You can still do that. There's less of them, less insurance agencies offering long-term care insurance anymore. So you have to search a little bit higher. The premiums cost more. But for folks who maybe bought those long-term care insurance policies many years ago, those are your things to use as your care needs are starting to mount. And don't be hesitating to use those. That's exactly what you paid into all these years, is to have that help. Other financial tools that are available are reverse mortgages. One of the things with a reverse mortgage is people do need to intend to remain in their home in order to be able to capture that reverse mortgage. So, you can't be looking at placement in a care facility while getting a reverse mortgage. There are charitable gift annuities where you can give a large gift of, say, a car or a home or something to a charity. They will receive that upon your death, and the charity will give back to the person a part of what that asset is valued at for the person to be able to live off of and use to pay for care. And there are converted life insurance policies where you can get a term policy changed over to a permanent policy and have the option of accessing the cash value of the policy to help pay for care. Medicaid is a program that is available to us that we're going to talk about in just a moment here, as well as VA benefits. Okay, so first of all, we're talking about Medicare. So Medicare is our federal health insurance program that anybody who's employed and spouses and other family members who are employed, we pay for, support the program with our Social Security deductions. And so it is an entitlement program. It's not based on financial need. As long as we have paid into it for the required amount of time, we will qualify for Medicare upon age 65 and earlier if we are diagnosed with some specific diseases and or disabilities that qualifies us for Social Security disability income. What does Medicare pay for? It pays for our medical care, our doctors, our hospitalizations. It can pay for skilled nursing facility care when we are needing rehabilitation, for example, after a broken hip. And it can pay for some home health care after a hospitalization where we are needing some further assistance at home, perhaps with some nursing care, say, for example, with wound care, and or with some maybe at-home physical therapy in order to rehabilitate. So those are the things that it covers, and majority of us will qualify for Medicare if we or our spouses have been employed and contributing through Social Security. So it's not, again, based on financial need. This is an entitlement program. Medicaid is called Medi-Cal in California. So it's Medicaid across the other states and Medi-Cal in California. And this is a need-based program that is funded jointly with both funds from the federal government as well as the state. And Medi-Cal will cover in-home supportive services for people who are needing some care. If you have Medi-Cal, you can qualify for some in-home supportive services where you may get paid by the hour in order to provide care for your person living with dementia, and or you may be bringing in a hired caregiver through IHSS to be providing care. So it is limited in terms of, it doesn't provide 24/7 care, but it does provide some in-home care that can be a big benefit to folks. Medi-Cal can also help cover the cost of those adult day programs we talked about, the CBAS programs. And again, if you have Medi-Cal, you become eligible for Medi-Cal. The adult day health centers the cost of those can be covered by Medi-Cal. Skilled nursing facilities have Medi-Cal coverage as well for some of their residents, not all of them, but some of them. And if a person is needing that level of care at skilled nursing, then that is also something that Medi-Cal can cover. And then we have a program through Medi-Cal that's called the Assisted Living Waiver Program. And Preston, do you want to maybe step in here? Could you just give us kind of the latest and greatest updates on the waiver program? My understanding is that it's still in effect, but that there's a long waiting list for it.
Yeah, I mean, it's an option, I guess, but the waiting list for it is, last I heard, it was over a year, maybe like a year and a half, maybe even 2 years to get it. So it's it's an option, I guess, and maybe I should put that more in quotes, because if you're needing it immediately to try and get in, it's not going to be an option. So there does need to be some planning
Yeah.
involved there, but it it's there, but like I said, it's about 1.5, 2 years, I would say,
Yeah.
to get it.
That's what I've heard too. And, just to kind of clarify a little bit, the assisted living waiver program is a program that's been going on for a few years already, where the program Medicaid, so the state and the federal governments are testing to see if having Medi-Cal cover some of the costs of assisted living is cost efficient. And, Preston and I know, and every health professional in San Diego, and I'm sure in California and probably across the nation, we all know that it is much more cost efficient than the skilled nursing facilities. However, it's the government, and they like to take their sweet time in coming to their own conclusions.
Mhm.
So that is what the waiver program is about, that they are, in some cases, if you qualify for the waiver program, they are looking, and you have Medi-Cal, that you could potentially be living in an assisted living facility that Medi-Cal is helping to pay for. And, as Preston said, the wait list is lengthy for it. All we can do is hope that they will soon, hopefully, decide that they've had enough of the study results and just get on with it, so that assisted living facilities will be covered through Medi-Cal. But it's very limited in scope right now, folks. So veterans benefits. And again, if you contact us, we can give you more detailed information and contacts for veterans benefits. But of course, one of the things veterans benefits provide is health insurance for medical care. There is disability income that is service connected. There are pension benefits to veterans benefits, both the traditional and the non-service connected. And I'm going to talk about that one just briefly, which is the aid and attendance program. And this particular program is for applicants who need financial help to pay for care in the home, or to pay for an assisted living facility or a nursing home. And it is a non-service connected disability benefit. It is a benefit to wartime veterans with limited or no income who are 65 and older, and who were discharged from a branch of the United States Armed Forces, and also served 90 days of continuous military service, active duty, with at least 1 day during during wartime periods. So World War I, II, Korean, Vietnam, and the Persian Gulf War. So, you do not have to have served in combat, but rather in active duty for 90 days during any one of those wars, in addition to those other requirements. So it is a really good benefit that many people who are veterans can qualify for. And then there are also caregiver support programs through the VA. And these are adult day health care, supplementing the cost of that, homemaker and home health aid program, and also to provide temporary respite. So variety of different programs. We want to make sure you access the ones that are going to be of benefit to you. So for more information about all the financial planning and long-term care that we've talked about, and which, by the way, we are not financial planners or VA specialists or attorneys ourselves, we really do want you to visit our webinar library. And we just had a legal and financial basics program just a couple of weeks ago, and it is in the library, and you will get more detailed information there. And additionally, again, you can contact us and we can send you out the resource lists and information that we have in these areas. And so let's see, let's just take just a couple of minutes for questions, and then we need to just wrap up.
Sure. So let me just send the link real quick. The webinar library, all the links that Jean was talking about are in the general chat. So if you need to follow up with us, or if you want to access our education classes, the links are in the general chat. One question that kind of came up a couple times was that when people have kind of they've accessed in-home care in the past, but they find that that it could be limited, that the caregivers is kind of limited to like trying to help with care, and then they're kind of struggling with kind of different stimulation activities. So is there anything as far as advice that you have to kind of address this, or how you can bring that up, or if they're really qualified for stimulation activities, what would you say to that?
Actually, I'll tell you what I would say is contact us at Alzheimer San Diego, because we can have a good conversation with you about what you need to be communicating, first of all, to the people who manage and run and own the in-home care agency, so the supervisors, in addition as to how to have those conversations with the person providing care. Oftentimes, people just need more direction, and we can help you craft that plan and to give you the language in terms of how to have those conversations and how to support those efforts. Sometimes just spending that little bit of time working on that is enough to help the in-home care providers to really kind of discover new ways of engaging with the person living with dementia and being able to do those, think more freely about what activities can we do together. So we've got lots of good information there. So contact us and we'll get you fixed up with that. All right, I'm going to continue on because we actually are at time and we're just about done. So for resources and support, folks, here's the important thing, is to start the conversation. Yes, get the right people to the table. So, that means the people who are the decision makers, both for health and for finances. You may be looking at spending some money here in terms of incurring costs. So you've got to, have everybody come to the table and get some level of consensus about what are the next steps. Start exploring the options before there's a need. Again, don't wait, folks, till you're in the midst of it, in the thick of it, and you're going, we need to do something. It's panic mode right now. You are going to have to assess finances. And, I wish we all had that crystal ball that we could look into and have a bit more certainty about the future, but we don't. And so we do the best we can. And then connect to local resources like us at Alzheimer San Diego. And I'll tell you, one of the things I think we're really good at is, most of the families we're working with aren't just using one of these resources we've talked about today. They're using several of them and kind of layering them on, use of them, as care needs are changing. So they may be starting with using things like community centers and social day programs. And then maybe they're using a little bit of also the Jewish older adult program. And then as needs are changing, maybe they're bringing in-home care in for a couple of days a week. And so it's not a kind of a one and done thing. And it requires, crafting these plans requires some work, some thought, some exploring of resources and looking at, how can you maximize your dollars that you're spending and maximize the care that you're receiving. So we can help you with that. So make sure that connecting with local resources means you're connecting with us. there we are. Talk to the dementia experts like Preston and I and the rest of our great team back at Alzheimer's San Diego. I say back as if we're all back at the office. We're not yet, but we're working towards that, folks. We have virtual support groups for you. We have our online education and training, like today's session, in addition to others. We have our really wonderful volunteer tech team. Tanvi, are you there? She's maybe busy with another client right now.
Hello, sorry.
Oh, there you are. We just want to say
Yes.
thank you. We really
Oh, no
appreciate
problem,
you
no
being
problem.
with us.
Sorry.
We
Yeah.
have social activities and outings, which, yay, we're happy to say have started up again. And please have a peek at our website to see what's going on there. All sorts of fun things. They're in person, folks, socially distant, but in person. We do support local research and stay very closely connected to it. We've got a really wonderful All's Companions program that Preston is very involved with, where we have trained volunteers going out to the home. We're starting to get back to some in-person. It's slowly moving, but we're moving that way. And this is providing companionship to the person with dementia and some respite for the care partner. We have Vitals, which is the VIT, Volunteers in Touch, for people who are experiencing some type of dementia, the symptoms of dementia, or have a diagnosis and are living alone in community. So there's our email, or excuse me, our website, and there's our phone number. Give us a shout. There's more. Preston, can I get you maybe one last time, if you wouldn't mind, to send out the follow-up form in the chat. And then upcoming care options, residential, what is it called? Residential placement on Wednesday, July 7th. So that's next week, yes. Driving and memory loss is its own webinar because it's a tough one. There's a lot, as you can imagine, lots to think about and talk about with driving and memory loss. That we are presenting in partnership with Elder Help on Thursday, July 15th. And you'll see details and pre-registration at our website on classes. And lastly, of course, we always want your feedback. So when we wrap up, you'll receive an online survey, and we ask, please, that you complete that for us. And as we have also said, you will get a copy of the slide deck from today's program, and that will be emailed this afternoon to all of you. So we thank you for joining us. Thank you for being my wingman today, Preston. I really appreciate it, and all of your expertise as well, too. And
well, thank you for leading us through this really important topic today, Jean.
Yeah, and very dense information-wise, too. So thanks everybody for listening to me talk. So we hope you find the information helpful. Please reach out to us. Thank you, everybody. Stay healthy, get out there and enjoy the sunshine and the nice weather. And I hope you all have a lovely 4th of July as well, too. So thanks, everybody. We'll see you next time.